For many women, pregnancy is a time of constant change.
But complicating it with a cancer diagnosis can feel catastrophic and life-threatening for both mother and baby.
However, women can safely get treatment while pregnant and give birth to healthy babies. It's been done for decades.
Reporter Kristen Crowley shows us why misconceptions about treatment can be deadly and introduces us to a mom who says getting a second opinion saved both her and her daughter's lives.
At just 35 years old, Reggie Hong is a survivor. Battling an illness she thought she was far too young to endure.
What is it like going through cancer treatments?
Cancer treatment is not easy.
Reggie's breast cancer story starts like many others, when she noticed a change in her breast, in her case, dimpling.
About a week and a half later, I got the scan from hell.
What did it say?
A 4.2 centimeter tumor and an affected lymph node.
But Reggie's breast cancer journey would not be like many others, because her diagnosis didn't just affect her.
I was 15 weeks pregnant when I found out.
Pregnant with a little girl that she and her husband were eager to meet. But how could she treat her cancer and safely continue her pregnancy? Her doctor said she couldn't.
And he's like, I don't think she's gonna survive. And you should consider termination.
What did you think when you heard that?
My husband and I, our hearts just dropped. And we just couldn't imagine that. You know, we'd given her a name. We just did a gender reveal cake.
It's pink!
Reggie was prepared to forego treatment entirely to save her baby.
Oh, you're gonna have a baby sister!
Potentially sacrificing herself. A decision she wouldn't have to make.
Where's her head at today?
Way down here.
Because her doctor was wrong. Not only could Reggie continue the pregnancy, she could get treatment.
We can successfully accomplish both goals of great cancer care and having a great full-term pregnancy.
Dr. Jamie Wagner is a surgical breast oncologist at the University of Kansas Health System, the place where Reggie got a second opinion.
How long have we had this ability to treat women with breast cancer and allow them to continue their pregnancy?
Probably 2 decades.
But there's still this wide belief that if a woman gets cancer while she's pregnant, she needs to terminate the baby.
Mm-hmm.
What do you think the biggest misconceptions are about chemotherapy during pregnancy?
You can't carry a pregnancy if you're on chemotherapy, and if you do, you're causing harm to your baby.
Dr. Mark Parrish was part of Reggie's treatment team at the University of Kansas Health System. The maternal fetal medicine doctor says chemotherapy should be avoided in the first trimester because it can be toxic to DNA development. But after 12 weeks, the health impacts to babies, he says, are minimal.
So we know that it can make babies immunocompromised and it can cause them to be anemic. Both of those are correctable outside of the womb.
Have we seen any long-term ramifications to children who were exposed to chemotherapy in the womb?
Yeah, not to my knowledge. Not to my knowledge.
Cancer in pregnancy is rare, but it is on the rise. A study published in BMC Cancer found the incidence of pregnancy-associated breast cancer went from about 13 cases per 100,000 pregnancies in 1969 to 19 cases by 2022. And the American Cancer Society says thousands of cancer cases in pregnancy happen every year in the United States, with breast cancer among the most common.
I say breast cancer and lymphoma and leukemias are probably the top 3 things that we'll see patients get diagnosed with during their pregnancy.
Are you seeing more of these cases?
I feel like we're seeing more. Again, the question comes, why?
Studies suggest a big factor is maternal age. As you get older, your risk for cancer increases, and the average maternal age is rising in the United States.
Here's her foot, and here's her face.
Whatever the reason, the rise in cases coupled with the misconceptions of treatment makes sharing Reggie's story all the more important.
Do you think there are women out there right now who are pregnant, who get cancer, and who will terminate their pregnancy because they think they have to?
Probably, yeah.
Fortunately, she sought a second opinion, and I think that that's the important aspect of her story, is the value and radical change that you can have in treatment recommendations by getting a second opinion, but also who you get your second opinion with.
We decided to name her Elena because Elena means a light in the darkness, and that's what she was for us.
She looks like she's doing great.
She is. She's thriving. She's getting bigger and bigger every day.
Reggie completed 12 weeks of chemotherapy, all while pregnant with Elena.
All right, we're gonna ring it together.
And when that treatment was finally over, mother and daughter both celebrated as survivors.
My baby's fine, and we made it through, and it's just incredible to be here.
Reggie had a single mastectomy and still needs to complete radiation treatment, but she says her prognosis is good.
She hopes her story serves as a reminder to future moms out there to always get a second opinion, as it could save 2 lives.
Experts tell us something that can further complicate cancer in pregnancy is that disease can be missed. Women may attribute certain symptoms wrongly to their pregnancy, but doctors say regular checkups and conversations with your doctor can help ensure a healthy pregnancy. When women have children can have an impact because, as Kristen mentioned, experts say one risk factor at play is maternal age.
Reggie was 35 when she was diagnosed. According to the Susan G. Komen Foundation, women who give birth to their first child at age 35 or older are at a slightly increased risk for breast cancer.
But starting a family later in life is a trend that's growing.
Reporter Heather Graff joins us now to explain why.
Lee and Tisha, according to recent data from the National Center for Health Statistics, more women over 40 are having children than ever before, for the first time surpassing the teen birth rate. In 2023, they made up about 4% of all births. It might not sound like a lot, but it's more than a 3-fold increase from just a few decades ago. Dr. Dallas Reed is the director of perinatal genetics at Tufts Medical Center in Boston. She says advances in fertility technology, like IVF and egg freezing, have helped make motherhood more feasible for some women.
I think they certainly lengthen the time that people may have to have their children and kind of slow that clock down.
But that decision to wait isn't always intentional, as many couples struggle with infertility. Still, Reed notes putting off parenthood can also have advantages, with parents having more time to gain financial security and life experience.
I think that stability piece is a big benefit and helps the couple, but also the child, give them that good foundation to be able to excel.
For women of any age planning to have children, experts say there are steps you can take to increase your chances of a healthy pregnancy. Among the recommendations, talk to your healthcare provider about your health history. Get 400 micrograms of folic acid daily, cut out alcohol and tobacco, and maintain a healthy weight.